Thank you, Madam President, Senators. I stand in support of the concurrence with Assembly amendments on SB 107. However, I think it's important that when we debate the issues here, that we actually not exaggerate and talk about the facts. So I am a parent. I'm raising two. I have one's a teenager, one's a preteen. So I know many of you here are parents. I'm also a pediatrician whose job is to help assist parents in, and advise them on their health. And I think it's important we talk about the facts. So first of all, there's actually, when it comes to surgery, because that was mentioned, there's no recommendation for surgery essentially before the child is no longer a child and is now the age of majority where they can make decisions on their own. So that is not what's recommended by the medical profession. And I think it's important not to actually exaggerate about that. We actually had, unfortunately, there are people who have done that on social media that's led to actually a bomb threat at a children's hospital recently. So I think it's important that we share accurate information and not incite these types of actions based on misinformation. I'd also make note there actually is research and studies, long-term studies, looking at puberty blockers. We also know that there's research showing that youth who are questioning their gender identity, that first of all, many of them don't change their minds. I'm not saying it never happens. But by the way, most of the treatments that we provide to youth of that age is reversible. For example, puberty blockers, right? And that denial of those treatments have long-term and significant consequences, including depression and suicidality. And we know that the rates of suicide in these youth is higher than it is in other youth, especially if they are not accepted. So when it comes to what our role is here in trying to protect the people of California, including our youth, we want to be sure that we not just Google, but actually talk to experts, people in the field, people who actually work on these issues, I'd say every day, but at least frequently, who actually spend time investigating these issues and learn the facts and use those facts to make our decisions. So I realize people may come to different conclusions, but let's at least start off with what is actually true and not make our decisions based on exaggerations or inaccuracies. I respectfully ask for an aye vote.